All right. Hello, everyone. This is Victoria, your clinical educator, and I am currently trying to create just a quick reference video about using the Code Blue and rapid response documentation intervention here in Epic. All right. And so I would like to log in into our playground, which everyone should know if you have done a Crack the Code class with me. That is our yellow interface here. And so I am going to log into the playground using a login practice ID. And so if you ever want to pull this up and practice yourself, you are free to do that. Please log into your yellow Epic workspace and enter in an ID that is approved for training purposes only. Okay, so we are going to do that here together. I'm going to enter in IPRN. We'll just do 01. And you can do IPRN 01 to 099 or 99. And our password is going to be train. And we're going to log in. Okay. As you see, it will pull up our departments, and we're going to just work in the med surg department. This code/rapid response intervention looks similar for all people who are going to be recording for a code. Okay. So we are going to open up our training environment. Okay. Okay. We are going to exit out of our videos. And so as we did from the Crack the Code, I would have us open up our first patient on our list here, which is Gerald. So we're going to open up Gerald and get his chart going. Okay, we're going to exit out of this OPA because we will not need it. So got it. Okay. So the first thing that we always teach y'all is to find your code rapid response tab. So if you're looking up here at the top, sometimes your code might actually be hidden in the additional activities drop down here. And if that is the case, you would just click on that drop down and you would just scroll down until you could find code/rapid response documentation. Okay. Here we see that it is already up here. And some of y'all might actually have a tab with 3 dots on it. And you can absolutely use that tab as well to click on those 3 dots and obtain your intervention here. Okay. And so we tell you, if you know that you are going to be the recorder essentially for your unit, be it you are selected by nursing services at the beginning of the shift, or if you are working in an outpatient facility and you just know that you are going to be the recorder for your shift duration. We say you can always right click on your tabs, mark them as important, and blow them up to make them bigger and more obvious, and then to left click on your tabs and drag it to become one of your first few tabs here in Epic, okay? So that is just the way so you're not searching for your tab in the middle of a code situation or a rapid response, okay? All right, so we are just going to identify the parts of the intervention that is needed to answer essentially what quality is asking for us to complete, okay? So this intervention, first and foremost, is going to replace the Code Blue form that we would physically fill out in the past and add it into the patient's chart. Everything is now in the EHR, where it is not required for you to have that Code Blue form anymore. We do the Code Blue evaluation form because that allows us as a hospital to evaluate over the components of the code so we can see what needs to be improved or what went right during the code and what we can continue on. So please still have your Code Blue evaluation forms to be given to nursing services or to your director so it can get scanned and faxed over to quality, okay? But as for your Code Blue forms, that is what this intervention will now replace. Okay, so let's take a look at this intervention. There's a lot going on here. So let's get familiar with what we absolutely need, okay? Over here in the left corner, you will see in purple medications, okay? And in medications, the great thing about this is that for every code or emergent situation you can think of, Epic has pre-populated some of the most common meds that we will order during, let's say, an ACLS intervention. Okay, so you have meds here in alphabetical order listed from adenosine all the way down to vasopressin, zirconium, okay? And any med you can think an emergent situation in between. These are your drugs for ACLS, for RSI, rapid sequence intubation. If you are having an anaphylactic reaction, you have these drugs here, okay? You also have here injections for boluses, dextrose for your low blood sugars. You have your sedation and analgesic medications. You also have glucagon, calcium chloride. Anything that you do not see on this list that you would need to add, you can have it down here in additional meds. You simply search for the medication and then you would add it using this green plus sign, okay? What these medications do, as we will demonstrate once we start our code, is that these are one-click meds that once you click upon it, not only will it go ahead and order the medication for you, it will ask you to place in the physician that ordered the medication and then document who is it that administered the medication. And it does it all in one click in one window, which allows you to quickly add in those emergent medications without needing to scan the vial. Okay, so that is what this is for. If we go over here into the middle, we see what's called the quick bar, okay? We've been calling the quick bar our one-stop place to jot down those quick interventions that we do, those pulse checks we do every 2 minutes, those swapping compressors, those pausing compressions. What is the current rhythm? What do we defib or cardiovert our patient is? Is it a synchronized shock? The beautiful thing about the quick bar is that you are not required to fill out every single box that is on this quick bar in order to document the quick intervention you did during the code or your team did during the code, okay? For example, if I only needed to document that we do not have a pulse without compressions, I can just hit the no, and then I can just hit the file here, and that would quickly document that pulse check, okay? All right. In the middle here, we have our event log, patient summary, and orders. While we are in the middle of the code, in the middle of the action, we want to only look really at our event log because this is where the sequence of events is going to start showing up. Okay, you see down here that it's asking you to choose a code or a rapid response. Depending on the situation you are in, we're going to choose the code or the rapid. Okay. Once we choose and we start, this is going to start our sequence of events. And we will see what that looks like here in a moment. Up here in the upper left corner in blue in staff, this is where you will see a roster of staff that have come to answer the code or rapid response. We want to accurately document what staff is in the room with us that is handling this emergent situation. Okay, this is the record of who all participated in our emergencies, and you will see a sign-off feature that allows them to confirm their events of the code as well. Below that here in this light blue tealish color and code documentation, Rapid Response also has a version of this as well. This is what quality is asking for us to complete these links here in order to say that we have a completed code documentation form, okay? So you as the recorder, this is where we are going to ensure is completed before we leave the patient, no matter what the outcome of the code or rapid is. So let's take a look at these, okay? Code start is essentially the same intervention as the choose to code or rapid response. Code onset will be what led to the events of the code. Was the patient conscious, unconscious, or what? Pulse assessment is essentially your pulse checks. Interventions are, what are the interventions that are being performed during the code? Assessment is the assessment of the patient in the middle of the emergency. External pacing is for if we are externally pacing our patients using our crash code, our crash cart, forgive me. Vital signs and I's and O's are exactly that. We are documenting vitals and we are documenting any intake or any output, fluid output that we can see during the code. Notifications are who did we notify about this code? Did we notify family? Did we notify LOPA? Did we notify our law enforcement agency? Did we notify the chaplain or priest? Code in will end the sequence of the code. So all codes must have a code start and a code end. Okay. And then finally, the code outcome. Did this patient survive the code? Did they not survive the code? Why did we end the code? What was that outcome? As you see here for rapid response, it flows in a similar means of interventions. We have our rapid response start, the onset, what led to us calling the rapid, airway, and then anything we are doing to support the airway. What are the patient's vital signs in intake and output? The outcome of the rapid, did it improve? Did the patient show improvement? Did they get sent to the ICU? What happened? And then the end, so we can end the sequence of events. Scrolling down here, we have an existing LDA list. If your patient has IVs, any lines, wounds, this also shows what they currently have, as well as anything additional that you may add during the emergency. And then a way to open your LDA. Everything that happens during the emergency, anything that you document as the recorder will happen in this window. And so once you start clicking on these links for your LDAs, you will see an additional window pop up, which will allow us to place IVs, place airways, ETT tubes, place any drains if we inserted a chest tube, place Foley catheters. That window will open and populate with these preset links, and we can document what information we know about those lines. Okay. Assessments down here are additional links that takes you directly to that part of the assessment in the emergency. So any interventions, any cardiac, respiratory, if it is a code stroke, you have your stroke assessment there. Quick Notes is a function that allows you to blank note document anything that happened during the events of the code that you cannot find in any of these other interventions, okay? So say a family member came in and they wanted us to end the events of the code due to family wishes. And while we can document that in notifications, we can get a little bit more detailed about why the family perhaps wanted to stop the interventions. And you could document that in the blank note. In addition, if we're doing a debriefing and we want to document the events of the debriefing, we can use blank notes to record that into the interventions as well. But please fill out your evaluation form so quality can follow up. Okay. And these circles here that you see next to the links, you see how they say not documented. Okay. For every intervention that you fill out, no matter what the minimum information you put in, a green check mark should show up next to these interventions, all right? Quality has stated that if all green check marks are filled into the circles, be it a code or a rapid response, and it has a start and an end time, as well as an outcome, we have fulfilled all requirements for a code documentation. Okay. So now let's take a look and see what this looks like in action. We're going to start our code and we are going to just go through and use all of our required interventions here and medications to see what that looks like. So I'm going to start my code here. You can either start it with the button there or start it at the code start. They both do the same thing. And we're going to make sure that we have the right date and we're going to time it. I'm going to hit end for now. As we know, Epic made shortcuts on everything. So we hit end for now and we're going to time our code, make sure the date is accurate. You're going to see on every intervention you have comments. You can free type anything that is happening during your code. All right. And so we're going to hit accept, or if you want to quickly accept without having to scroll and find the accept button, you can hit Alt A. Looking at our event log, we see that we have a timestamp down to the second. Epic times everything down to seconds here. So we have our hour, our minute, and our seconds. We have our type and our event, which is the code start. Okay. Over here in the user, you'll see who is documenting on the code in their initials. If you highlight over it, it says the full name. Details, you will see details of any free typing, any clicking that you do in the middle of the intervention. And if you ever need to edit, if you need to say, oh, actually, this code started 2 minutes ago, we can always go to the pencil that's next to the event, and we can change that to reflect this code started 2 minutes ago. And as you see, it will update. And additionally, you'll get two timers down here. One is the code duration. This is saying the start and the stop time. Okay, and how long the code has been going for. Here on the playground, they give us a few minutes ahead of time. In your actual Epic window with your code, it should start counting from 0. You also get a pulse check window that tells you yellow is, hey, your pulse check is about to come up, and red flashing is, hey, you are due for a pulse check. You may pulse check here in your timer to use it to help you keep up with time. You may pulse check up here in your quick bar. You may pulse check over here in code documentation to get your pulse assessment. I always need to make sure that to get your green circle, make one of your pulse checks at least through this link, okay? So now let's start working through our code. Let's say we are starting a document. I want to go ahead and do a pulse check. We know that initially we had no pulse. And so I'm going to click on my intervention here. I know we have no pulse, and the patient has no heart rate on their own. And I'm going to time that for 11:06. Okay. As long as I am timing within the start and end times of my code, I can always go back and adjust times on my intervention to better reflect the timing of that code. Okay. All right, so you see here in details, we have some details in our timeline now. We have pulse check, pulse with present without compressions, no, heart rate of 0 by the login user. And then if you look over here, you see that it is populated green. It was documented on at that particular time. Okay, so I have my green check mark on that. If I wanted to make any additional pulse checks, I can do it with my quick bar or with the timer down here. Okay. If there's a lot going on, you can completely ignore this timer. It is just there to be an aid to you. You do not have to hard focus on these timers. Okay. All right, so we've done our pulse check. Let's say that we initiated compressions. We know our patient did not have a pulse. They are currently in VFib, okay? And then we're just gonna hit file. I wanted to show you what that quick bar looks like. So you see here it says from the quick bar, I've documented that there was no pulse. We initiated compressions and the rhythm is in VFib, okay? That is what quick bar looks like. If you don't need your quick bar in that moment because a lot is happening, you see these arrows here in the corner, we can collapse the quick bar technically for now, and we can always open it back up when we need it again, okay? Let's just say for now that it's just me and my fellow nurses that are in the room, okay? So I wanna go ahead and add the nurses that are in the room with me, okay? So I'm gonna add staff. Right now I have no staff added. Okay. If you are already on the treatment team, you will be able to be pre-selected by boxes that will show up underneath the category that you're in. So if you are an RT and you have registered on the treatment team, we will be able to select that RT from the team. Okay. For now, we're just going to add our nurses. Okay. So you are going to add your nurses. You can add in by last name. You can search them from this list. You can type them in directly, or if they're on the treatment team, you can select them from a pre-selected list. Okay. We're going to just add a couple of nurses. This is what that pre-selected list would look like if we were to physically add them from the treatment team. And let's just say there's a couple of people that are coming in that I'm not too familiar who they're with, okay? We have this plus sign next to an unknown, where we can select the unknown and we can add their presence into the team. We can always go back and edit and put their names in once we get their names, okay? Down here at the bottom, you see mark selected as arrived or paged at this time, okay? I'm gonna mark them as arrived because these are the people that are in the room with me now. If I've called for the doctor, if we called for the RT, we can do a paged, but we're going to do the ones that are in the room with us now. And as you can see here, I have staff. I have this nurse and two nurses. I don't know who they are. Once I figure out who they are, I can highlight over the unknown, click on the pencil here, and update with their name, okay? So we're just gonna pick another nurse. We're gonna say Amanda came in and helped us, and we can change Amanda's name. See? Okay. So now that we have some basic staff, let's say we're starting the ACLS protocol, okay? We're gonna do a rhythm check here so we can reset our timer, show you what that looks like. They have no pulse, they have no heart rate. We're gonna hit okay. So as you see here, now we're on white and the timer is counting down from 2 minutes, okay? And you see that our bar is starting to fill out here, okay? So now we're putting pads on the patient. If you go to interventions, you can see here that a lot populates onto this screen, okay? You have a lot that's going on here. If you ever get overwhelmed and you can't scroll through the screen and find what you're looking for, free type it up here in comments. You can say pads placed on patient. If I don't know anything else, I'm just gonna hit accept on that. And that's going to capture that here in interventions. You see pads placed on patient. And I still get the green check mark next to my intervention because I fulfilled that minimum requirement, okay? In addition, we place the pads on the patient. We're gonna shock them. I'm gonna use my quick bar. They say, let's shock at 200 joules. It is not synchronized, okay? Patient is in B-fib. We pause compressions. Everyone clear? The shock was administered. They shocked him, and then we're going to resume our compressions. I'm going to use my quick bar and say compressions resumed. Move that out the way. As you see here, I've caught that we paused compressions. We shocked them at 200, and then we resume compressions after, all right? So now they're preparing epi. So I hear that, my team is starting to prepare epi. And as we're getting ready to prepare epi, I'm gonna go ahead and kind of pre-scroll down to where I would see the epi administration, which is in ABC order. We see here epinephrine, adrenaline, 1 milligram and 10 milliliters. That's how we have them in our crash carts. So I know I'm gonna get ready to prepare that. I'm not going to administer it until I hear epi in, but I know that that's coming up. So I'm kind of eyeballing that, okay? While they're preparing the epi and doing their chest compressions, let me go to my code onset. This is a code 44 adult. This is how Epic just codes them in. This is an adult. I don't know much about this patient. I don't know if this was witnessed or unwitnessed. I'm gonna hit unknown. I don't know their last seen normal date or normal time. Anything I don't know, I'm not going to document on. Epic does not require for you to fill out every component in this window, okay? I just know that the RN started the code, and I know that it is an adult, and I don't know anything else. So I'm gonna hit accept, okay? And as you see, we caught code onset. It's an adult, unwitnessed, unknown witness code started by the RN. If we ever need to go back and add more information, you can always edit the information that you have here, or you can click on the link and just continue to build on what's already present. Okay. So now they're administering the epi. As you see, it was time for another pulse check. So we're going to do another pulse check. They have no pulse. Now they're administering the epi. Okay. We're going to document and say that patient is still in VFib. And you see, I just quick barred, just catching it, that patient's still in VFib. They're getting epi ready. Remember, I eyeballed my epi earlier? So now we can click on the epi. Okay. You see how you click on the epi and it says here, new administration for epi, 1 milligram, 10 milliliters. They're going to ask you who ordered it, right? And let's just say I don't have the doctor in the room with me yet because I only have members of my code team, but I know my patient is being taken care of by Dr. Whitecoat, right? We're going to administer the epi. He's under Dr. Whitecoat's care. And we're going to say Amanda gave the epi. We're going to select whatever nurse is in the room with us. Hopefully it's going to be an RN. So we're not going to say Amanda did it. We're going to do RN. I'm going to say this nurse gave the epi, right? 1 milligram of epi. You can say it's in the left arm, right arm, any IVs you want to document, put in as much information as you know, hit accept. Okay. Two things happened here. Epi was ordered and given. You see the information that we documented. We see the doctor that ordered it, okay? Additionally, over here, you see that we've automatically added a couple of staff members that are a part of this code, okay? So our staff is now up to 5. We've documented and administered the epi. We can go back and say compressions were resumed, okay? Circulating. And down here, we see that an epinephrine timer has also started. And this is just something to help us see when is the next time for the next epi, okay? Our timeline is continuing to build. Let's go over into assessment. Let's just do a quick assessment. I don't know much about this patient. I just know that there are exceptions to everything that are happening. He is not having normal circulation. He is pale. He does not have a supported airway. Right now, there's nothing obstructing it, okay? He is not breathing on his own. And as you see, as I'm clicking onto things, Epic likes to add more information in to say, okay, get more detail, get more specific, okay? And you can get as specific as you like, but if you don't know any of these things, it is okay. You do not have to fill it all out. We can say, okay, this patient right now is being bagged, BBM. I don't know his SpO2 because we don't have a monitor on him yet. I know that he's just disabled. He is unresponsive. I know he has a Glasgow coma scale of 3, so I'm going to say 999 because he's doing nothing. And we have not had an EKG yet. And then I'm going to hit Alt-A and just put in what information I know about the patient. If I can't find any of this information to click on, I know that I can document, free type document in the comment. I got my green check mark. I'm good. Okay. You see here it's time for another pulse check. We can restart it. We can say no pulse. As these events are going on, we're talking to our team. Doctor is saying, hey, let's get ready to shock again. We're going to pause. Patient is still in VFib. We're going to shock this time at 300, not synchronized. And because I'm demonstrating this, I know my times are off. We would be much, much quicker than this, okay? All right, we're going to resume our compressions afterwards. We documented everything that's happening in front of us, okay? So we know shock. We know, because we are ACLS certified, that amiodarone is going to come up next. So I'm making sure I'm eyeballing my amiodarone that we're going to administer. I'm going to keep going. I know here we're not pacing you because we are doing a full code. So external pacing, we're going to say no. I'm going to hit accept. Okay. My vitals. I don't have any vitals. So the beautiful thing about Epic is you see these red heart stops here. These are not actual heart stops. These are just telling you, hey, make sure you document respiratory. Make sure you document heart rate. What is your temperature? If I don't have any of those things right now, because we're in the heat of the code, I'm just going to document what I know. Okay. If this patient is an inpatient, they should already have a height and weight, so you do not have to put in a height and weight. If they are an ER patient that are coming in and you don't have a height and weight on them, estimate your height and weight, or if family is there, they can tell you, you can put in that height and weight, and then you just say if it's estimated, state it. Blood glucose is also here too. If you got a sugar on them, we can put a sugar in, so we can set it, the sugar is 20, very low. Any intake, so if I don't add in a bolus here, from my hyperlink, I can always put in an IV bolus of whatever fluid I have here. Okay. And then any fluid loss that I can see, any fluid loss that can actually be verified and documented. Okay. And then our patient, we can't assess pain right now because they are coding. So we're going to hit accept and check those off. All right. It is time for another pulse check. We do not have any. Okay. And we're going to give amio. So amio is ordered by Dr. Whitecoat. It is given by the same nurse that gave the other meds. We know that we are giving 300 milligrams of amio. It's going through the left IV. I'm going to hit accept. Okay, so we gave 300 amio. Chest compressions are resumed. And let's say that they swap compressors. We're going to say our compressors switch now because our first compressor got tired. Okay. All right. So moving on, we're doing a lot for this patient. So let's go ahead and notify some family. Let's say we called the family, said patient's not doing too good. Let's say we called the attending, and there is not a choice for attending. It says primary care. So I selected other, and I'm going to type attending here. Okay. Hit that. All right. See the sequence of events that are coming along. We see that my check marks are being hit. Okay. So we notified the family, we notified the attending. Okay. RT is there. They're going to help with intubation. So we're going to bring in a respiratory therapist. I don't know their name. Hopefully your respiratory therapist is already there. Okay. We're going to bring in a respiratory therapist. We're going to get some RSI drugs ordered, ready to go. Okay. So we're going to need rock. We're going to need VEC. And we're going to say it's being pushed and given so that way they can be intubated, okay? All right. Rock. VEC. Anything that you want to give. Here, this is based off of the weight. So you're going to make sure that you put in accurate weight, administer dose, okay? All right. Now we're going to intubate them, okay? 2 ways you can document intubation. We can either click down here on airway vent, which will give us a chance to say that they're intubated, okay? You can also do it in interventions if you can find it, or we can add to the LDA. So today we're going to add to the LDA so you can see what that looks like, okay? We're gonna add ETT. Okay. We're going to say that we are placing, they're intubating him now. So we're gonna say today, T for today, N for now. Was it in place on arrival? We're gonna say no. They say we're dropping down A7 into our patient. It's gonna be cuffed. They inserted it once. It was placed by the physician. Then they used the glide scope. And then we need to verify the placement. How did they verify? We had color change. We auscultated and listened. Okay. And then we had wait for a cap knob. Hit it set. As you see here on my existing LDA sheet, I got an ETT added to that with all the information I documented. It's also here on the LDA or the timeline. All right. Let's keep going. Let's say, okay, well, we're gonna add a Foley as well too. Okay, I'm gonna click on Foley or urethral catheter. We see the LDA populates. We're gonna say it was placed today, so T for today. And for now, it was not there before. Yes, 2 people were in the room helping me with this and stay sterile. Inserted by my name, RN, or whatever you want to say, okay? If you don't know any of the catheter type, balloon size, you don't have to fill out all of this. You just fill out what you need. Hit accept. That populates on the existing LDA, okay? By this, you're going to have, okay, pulse check, pulse check, pulse check, okay. No pulse present. Compressions were paused for the pulse check. Patient is still in VFib. I know we need to get ready to shock them at 360. So they say clear, clear, clear. File. They shock, okay? Oh, we got to get another epi going. So I'm scrolling back up. Here's the beautiful thing. We know that epi is getting ready to go. You see this check mark here? That lets you know that you've documented one epi already on the patient. Okay, you've documented an amio. You can click it again and it'll have the same information there for another administration of epi. All right. Okay. So let's say family comes and they're just like, okay, enough. This is just too much, sadly. You need to stop. Okay. Doctor looks at everyone, Dr. Whitecoat, and he's going to say, all right, stop. Okay. We're going to have to end the code. And we can say family requested in a code. So we got to stop our timeline. Okay. But wait, I still have a couple of unknowns. I need to go back in here. I need to get their names. So I need to come through and I need to get their names. And in this case, we're just going to select a couple of people because this is the playground. So we don't need anyone specific because we don't have any workers here like in this playground. So we're just going to select a couple of people. We're going to say that that's Casey Abbott. And then we're going to say that RT there was, let's try to see, can I find an RT on here? If I can, I'm just going to pull somebody. We're going to say that that was Victoria. Okay. As you see here, we have our staff sign off. Our sign off is a saying that each member that's on this team is going to sign off on the events of the code to see if they're accurate. So that's going to remain until every member of the code team that was in there will sign off on the events. Okay. Down here, we see that we have all of our checklists, but I need an outcome. I'm missing that part. And so I'm going to go to code outcome. This is after the events of the documented end time. So I need to document this outcome within that end time. So we ended the code at 11:30 and 36. Okay. So let's time it for 11:30 and 35. We're just going to make sure that it's in the timeline. That warning goes away and we say, note, patient did not survive. Code terminated due to. We're going to say family requested, and we're going to hit accept. That catches in the timeline. Code outcome, survival, no. Code termination due to family request. The staff that departed, and then family requested end of the code. And as you see here, we have all of our green check marks as needed. We have all of our currently existing LDAs. Okay. And let's just say I needed to fill out a blank note regarding what happened here. Okay. I'm going to time my blank note. It says here, this is happening after the documented end time. And I just want to record that the family stopped the code. Okay. We're going to say at 11:30:05, so we can make sure it's in the events. We're going to summarize and we're going to say code in. And we're going to say family came into the room and demanded that all resuscitation events stop to allow the patient to pass peacefully. And then we can say white coat ordered, fur coat blue went to in. And anything else you want to document. Okay, we're going to hit Alt A. And that blank note now becomes a note in the patient's chart. As you see here, it says code documentation file, summary code in. Family came into the room and the minute of all resuscitation events stopped to allow the patient to pass peacefully. White code ND order for code blue sequence to end. That is captured in the timeline. Okay. All right. That is documentation of the code. All right. At the end, you will see that we have a complete timeline from our code start at 11:06 to our code end at 11:30 and 36. So our code went for a total time of almost 26 minutes. You see everything that was documented here, everything that was ordered here, ordered and given by the nurse that actually pushed it and confirmed. Okay. All right. And so let's say I'm looking through my sequence of events and I'm noticing like, there's gaps in my time. I was kind of off on a couple of times and stuff. And I want to make sure that this is okay. So for example, let's say, okay, chest compressions actually resumed at 11:18, not 11:17. Yes, you can go to the pencil where it says edit this event and we can change the time as long 11:18, as long as it's within the sequence of the code. We can update times as needed. Okay. Or let's say, I forgot to add, some vitals or the fact that we were monitoring something. Yes, you can go back to the link and you can add your vitals or you can add your I's and O's as long as it's documented within the events of the code. Okay. You just have to change your times and just add it. Okay. All right. Now, there are additional features on this chart, which as you become more proficient, you'll be able to do things. You'll be able to see previously filed essential flow sheets. You'll be able to look through the MAR and open up the MAR. You'll be able to look at orders that need to be acknowledged, any labs that need to be collected. You can print labels from here. Okay. But as you become more proficient and quicker at using this, what is absolutely needed is your medications, your staff, code documentation to be completed, or rapid response, depending on if it's a rapid, all of your green check marks, any LDAs that was inserted during the code needs to be listed on here. Okay. And then for every staff to sign off on the events of the code. When you hit sign off, this summary will pull up and essentially it shows the timeline of your code and asks for that staff member to verify that this timeline is accurate. Staff can make any additional comments and then they're going to sign. When they sign, you sign in using your network ID and then your password for logging in to your SSO sign-on, okay? Your single sign-on. And then a green check mark, just like this one here, will populate next to your name to say you've signed off. Okay, everyone. So that is essentially the code rapid response intervention in a nutshell. Practice, practice, practice. When you have some times on your units, downtimes between your patients when you can get them, open up your yellow Epic Playground, log in using the training password, train. Your user ID can be IPRN 01, 02, 03, all the way to 99. Okay, and practice using this code intervention. Just as we just walked through an imaginary code, that is exactly how you would practice on your code. Okay, the best way to get better at this is to practice. And if you ever have any questions, please, please, please feel free to reach out to me. My email is victoria.charles@christushealth.org. You can also message me on Teams. Feel free to reach out with any questions you have regarding this code documentation or this video. All right. Thank you for sticking it out with me. I know this video is pretty long. I wanted to make sure that I could be as thorough as possible. And feel free to join me in any upcoming Crack the Code events that we will be hosting throughout the summer. Have a wonderful rest of your day, and we will see you later. Bye-bye.